Hello and welcome back. What we're going to mainly look at now is utilising acupuncture, looking at the points so we can go through each of the points, what each of the points do and how they're going to benefit the patient with regards to treating symptoms of allergic rhinitis and how we can actually also address more the pathological side of things. By the end of the presentation, you'll have an understanding of the use of acupuncture and also the selection of key body points in the management of allergic rhinitis. You'll also have an understanding of auricular acupuncture and how to select key auricular points in the management of allergic rhinitis. So one of the key points you can actually use, and again depending on what the patient's presenting with, so as we mentioned earlier in some of the previous presentation, that headaches may well be one of the symptoms they may well present with. Same again, it may well be congestion. If one of the sinuses is actually blocked, they might have one-sided headaches or temporal type headaches, particularly if they're under a lot of pressure, under stress, particularly at work, and then they've got these symptoms to go with it. It can hinder your overall performance. Patients can start to get anxious, stressed. So this is where one of the points comes into its own, because again, it will help to ease off a lot of that tension. One of the key areas that brain has its effect is on the hypothalamus and the hypothalamus pituitary axis, which is one of the areas which also affects the body's inflammatory process. But this point, normally you've got your large intestine 4 here, quite a good effective point. And what you're going to basically do is to squeeze into that point, and you can go through slow circular stimulation. You will find a funny sensation when you actually do that. Now that point should be combined with liver 3. When used with liver 3, and if you notice where liver 3 is between this first and second digit, and it's about 2 centimeters proximal to the web space, and again you can stimulate into there, you're going to get a similar type of sensation in that particular region. And what you want to do is stimulate deep into there, where you're going to get kind of a dull, funny type of ache into that region. Now these points collectively, again, as I was saying, it will relax the patient, it will calm the patient. Any patient that's quite anxious and getting stressed about anything, then it will help to calm that patient. Very effective point for headaches. One of the key things to bear in mind with this point is if the patient at any time wants to utilising this point presents with a headache, sometimes it may make a headache a little bit worse before it makes it better. If they don't have headaches, this point on occasion can bring on a headache, and then it will subside, and then all symptoms will start to improve. So it's one that you can warn your patient about prior to any kind of treatment. So make sure you can utilize these 2 points in conjunction with each other. They are called the 4 gates. The reason why it's called the 4 gates is because you use all 4 points on the left and also on the right, and that applies to the feet as well, liver 3, both sides. Now key thing is, if I was treating somebody in clinic and I was going to needle those points, normally I'd leave the needles in for at least a good 30 minutes, if not longer, to get the optimum results of utilizing those points. The key thing is the longer the needles are in those points, the better the effect, because it takes a while before your body starts to release certain chemicals and get it into the circulatory system. Same thing will apply. Unlike the other points, what you need to be doing with these points is stimulate them on a regular basis. Maybe several times throughout the day you may well stimulate those particular points. However, you don't have to be as frequent with the other points as you would do with those if it's a pain issue that you're actually dealing with. Therefore, it allows the body to release its hormones and chemicals into the circulation. Therefore, you're going to get the optimum results from that. Now, this is one of your extra points, and it's called Bitong. Now, just adjust my glasses. Now, key thing about this point, easy enough to find. So if you come onto your nose, and just as you start to come off the bone, the part of your nose, you'll just drop into an indentation. So again, try and be perpendicular when you actually apply. So you're going to come straight in at that and be perpendicular as you actually apply. your stimulation. So it's literally just as you come off the bone is where you're actually going to find that point, and you're going to go in there and stimulate that. Now again, very, very good. It can clear the eyes if you've got itchy eyes, congested nose. So again, it can just clear all the congestion within the nasal cavity, and particularly anybody with sinusitis or any of those particular conditions, very, very good for actually addressing that. So that's one of the key points you're actually going to utilize there. Now, coming down from that point, what you're going to actually come down onto is your large intestine 19 and your large intestine 20. So if you're going to come down from there, just off that nose, off the extra point, then the first point you're going to come to is going to be 20. As you just follow your nose round, and just at the edge of that is going to be 20. Again, stimulate into there, and just as your nose kind of curves around, and at the end where it attaches, it's going to be your 19. So normally what I do is to stimulate, and then come down, stimulate these ones, and then follow that round, and then stimulate your 19. You can do it in that order. And again, if you want a needle, then by all means needle. If you are going to actually needle, then use a short needle. You don't use your 25mm, you'd use something like a 13mm in length, and of smaller, finer needles. Patients don't like to see you coming towards the face with a big needle, so therefore do use your your 13. I have seen pictures and patients, colleagues, where they've sent me case studies and they're using up to a 40mm needle in the face. Not recommended. It doesn't need, use the length of needle that's actually required. The face is highly sensitive, so it's not like your body. So again, going back to, if you're looking at your homunculus, it will show your homunculus normally has a big hand, big feet, big head, big lips. What that's basically showing you is the most sensitive areas of the body. So therefore your face is a highly sensitive area, so therefore it doesn't need as much stimulation as if you're going to put the points or utilize any points on the body. So do remember that. So therefore you can get away with using very fine needles on the face and you'll get just as good enough response. So do remember that. And again, these points on the face is very good for treating any allergic reactions or any inflammatory reactions in and around the nasal cavity, runny nose, blocked nose, sinusitis, those kind of conditions, and it does help with the eyes and the itchy eyes. So that's going to be quite good. Now what you can actually combine that with is what you call a yin tang. Now that's in the middle of the eyebrow. Again, you can come at it 90 degrees if you're going to stimulate it yourself. Again, excellent point for calming the patient. It relaxes the patient, keeps them calm, helps them sleep if they're having problems sleeping. And again, quite a good point for if they've got headaches or if they've got any congestion, if they've got any dizziness, or if they're depressed about the whole process. Particularly people who may well have it right the way throughout the summer period and they find themselves can't get out. So again, I'd be pretty depressed if I found that I couldn't get out, mainly because if I do go out, I'm going to start getting the runny eyes, runny nose. So it can start to get to you after a while. Now, your other point that you have got is your large intestine 11. Easy enough to find. What you're going to basically find is the crease on your elbow, and what you're going to basically do is to come in to that crease and stimulate. So just follow it to the end and just stimulate into that crease. Again, try and come at it perpendicular, 90 degrees, and stimulate into there. Again, you're going to get a nice dull ache. It's an immune enhancing point, and it's also manages homeostasis, also an anti-inflammatory point, treat allergies, infections. So that's one of the key things. And again, you may well find many patients that presents with these particular types of problems may well have psoriasis, eczema. So these are points you can actually utilize to also address those particular skin disorders. And you're going to find your spleen and stomach points, combine those, and that will also help to address some of your skin disorders as well as your allergic rhinitis. So again, you can get a combination. Again, even though I'm going through these points, do remember both sides. Don't just do one side of the body. I always recommend to do both sides. Stomach 36. Now, as far as I'm concerned, this is one of your, your spleen 6, stomach 36. They're a bag of tricks. If you have a tool, these should be in most of your tool. It's more like the ear point, what you call Shen Men. You're going to find most auricular treatment protocol is going to have your Shen Men in. Again, if you're treating musculoskeletal, most of your treatment protocol for your musculoskeletal disorders should have your stomach 36 and your spleen 6 in. Mainly because of what these points actually do. So in other words, if you're looking at tissue repair, fantastic. Enhances tissue repair. But also, these control the healing process. One of the main ways in which they control the healing process is having a direct effect on macrophages. Once you look at your spleen 6, it converts your type 1 macrophage into type 2. In other words, it takes it from being pro-inflammatory to pro-anti-inflammatory. And then it takes the healing process into the proliferative phase. Stops the inflammatory phase and moves it on to the proliferative phase. So that's pretty much how it's going to have part of its effect. Now, again, both stomach 36 and spleen 6 has actually been shown to have a direct effect on the antibodies, and also a direct effect on things like your interleukin 10, 6, and your immunoglobulins. Which are normally involved in the inflammatory process, and particularly with what's normally involved in the histamine production and things like that. So they're key points that you definitely need to have in your bag of tricks, and make sure you actually utilize those particular points. As I was saying, again, with your spleen 6, main thing about your stomach 36 and spleen 6, if the person's feeling a little bit down, those points are boosting points. Those points will help to energize the patient as well. So again, quite effective points, to help to boost the energy. Spleen 6 has a strong effect on the endocrine system. So once you start to look at, anybody who's feeling fatigue, allergies, immunological disorders, then spleen 6 is going to be a good point. And as I was saying, skin disorders, both those points will address that. And what I was repeating with regards to the macrophages, it will have an effect on the actual macrophages, and convert your type 1 into your type 2. Now, one of the key things that I found when I look at studies, as I was saying beforehand, one of the main things I look for is points. What points do they choose, and why have they chose those points? And what I'm finding is very few studies use spleen 10. And to me, spleen 10 is quite an important point for the management of allergic rhinitis. And what I'd normally suggest is, any of you who may well decide you're going to be treating yourself, what I'd suggest is stimulate that point. It's easy enough to find. So what I'd advise you to do is find the medial upper border of the patella, and it's 2 fingers, or should I say thumb's width, proximal from the upper border, and that's where the point's actually located, in the vastus medialis oblique muscle. You stimulate that point, and you can actually feel your eyes and also your nasal cavity starting to clear. So that's why you're actually stimulating that point. So what I'm saying is, it is quite an effective point to actually utilize for that. So they're your main body points in which you're actually going to utilize. But however, if you look at your ear points, again, your ear points have specific points, and these are quite strong, potent, very effective point at treating any kind of inflammatory disorders. So I'm not just talking allergic rhinitis, I'm talking rheumatoid, any kind of inflammatory disorders. These points will actually address them quite effectively. So once you start to look at your adrenal gland point, this is one that I use quite a lot in clinic. It is quite a good point, easy enough to locate. It's one that you can give your patient to do. I mean, all you've got to basically do is to point your patient to where it is. They're going to come onto it and stimulate it. So it is quite a good effective point. Apply pressure. You can actually apply seeds to those. So I do a lot of my auricular points where I put seeds on and I send my patients away, and it's easy for them to locate those points then and stimulate them on a regular basis. I normally advise my patients to stimulate, apply pressure to the point for about a minute. And I say, do it maybe 2-3 times a day, or if you can't do it 2-3 times, as long as you're doing it once a day, then that's good. What you basically find, any patients who's applying pressure, one of the key things that you do find is when the symptoms clear, they tend to forget to apply. I always say, try while the season's in, try and do it on a regular basis, or get into a routine. If I know I'm going cycling and I'm going to be outside, I'll get up, stimulate my points, go for my bike ride, come back, stimulate my points, have my shower. That's a routine. So therefore, it more or less keeps my seasoning frenzy and everything else at bay. Otherwise, if I don't do that, then several days or whatever later, once you get out of the routine, you think, oh, I'm fine now. Then that's when the sneezing frenzy and whatever starts to come back. So do bear that in mind. As I said, your adrenal gland point, very, very good, very effective. As I mentioned beforehand, your Shen Men, another very good point. It's a point that's used in most, if not all, auricular treatment protocol. Is your Shen Men. It's you can use it on a number of manner, easy enough to find. But the key thing about your Shen Men is it will help you to locate other reactive points. If you're palpating for a point and you find it's not sensitive, your Shen Men can activate that point and make it easier for you to find. It's also a point that's used to calm patients. So it can be used for detoxing, but in this case, we're talking primarily about inflammatory. And again, it's utilized a lot in pain management and patients that can't sleep, stress, insomnia, and also with regards to any allergies or inflammatory disorders, this point is used quite frequently. Obviously, you're going to use your allergic point. So that's kind of a common sense to say, well, if you've got an allergic point there, then you're going to utilize it. Important thing to bear in mind, so if I can just come and show you here, hopefully you can see this. Important thing to bear in mind, on the image that I've got there, what it's basically showing you is a blue spot on the top of the ear. That is actually underneath and not on top. So just something to bear in mind there, that you're actually going to be coming at it from underneath the actual helix and not actually on top. So that's where you're actually going to come. So literally you're coming underneath the ear in that manner and stimulate that point. Again, it is quite a good point. Patients who may well have asthma or any allergic reaction, then this is quite a good point to actually utilize. And again, I looked at quite a few auricular studies, particularly TCM ones, and for some reason they didn't use these points. Not sure why. I mean, okay, don't get me wrong, they still had a good treatment outcome, but I try to look at more specifics and look at what the points do and what the points have been shown to have an effect on. So common sense would have said, utilize that point. It is a good point. Endocrine, again, quite a good point. Easy point to locate. You just go to the bottom part of the ear, and bear in mind it's on the inner wall, so it's not on the outside. You just come to the inner wall, and then you're just going to stimulate onto the inner wall of the actual ear in itself. And that's, again, quite an effective point. Is going to be your endocrine point, along with your thalamus. Again, that's also on the inner wall. What you're mainly doing is coming a little bit further round, and that's also going to be on the inside of that part of the actual ear. Or the patient can come along and just pinch it and stimulate it that way. So depending on how they actually want to stimulate that. Again, mainly used in musculoskeletal pain management, and again, it will address the immune system and boost the body's immune system. You do need to be cautious with this. Those of you who may well be using auricular acupuncture to treat people who's pregnant, You do need to be cautious because this is one of the points that is actually contraindicated during pregnancy. So they are the main points that you're actually going to utilize. There are others, but what I'm saying is these are the most effective ones you can actually choose from. You don't necessarily have to use them all. You can use some of them, but I do say combine your body points with your auricular points. That's where you're going to get the best treatment outcome. Again, if you've got any questions at all at any point, then by all means you can email me info@stevebailey.acupuncture.com. Otherwise, those of you who subscribe to the CPD courses, then you can contact me within the community. Just pose a question there and I can get back to you and answer the questions that you may well have. Thank you for listening.